what is the recovery after lens replacement surgery? So initially, immediately after the procedure, the patient has blurred vision. Now, they will notice that things are clearer and sharper than they were before the operation, but because the pupil is still dilated, the vision is not quite fully clear. The next day, after surgery, the patient typically wakes and notices that they have very good vision. Now, this is typically 24 hours after surgery, and they find the vision is quite sharp for the distance. Reading vision takes a little bit longer to improve, and so typically patients 3 to 5 days after surgery will notice that the reading vision with their multifocal lens implant is beginning to sharpen as well. So if at our 1 week visit the vision is good, we plan a final 1 month visit to ensure that the vision is staying stable and that the patient's course of eye drops has finished and that they are coping well without the eye drops. If all is well at a month, then we will discharge the patient and we won't need to see them again. Of course, that depends on what the plan is for their fellow eye, so the other eye. Many of our patients choose to have both eyes treated on the same day, and the results of this surgery is truly excellent. Other patients are more conservative and would like to have one eye completed first, and the second eye surgery performed either 1 week or 1 month following the first eye. But once both eyes have been completed and the patient have had their 1 month course of eye drop treatment and their vision is stable and good at 1 month, typically we don't need to see the patient again afterwards.